Well, a warm welcome to today's talk. It's Tuesday the 4th of January. Now let's start with a bit of orientation today, because basically things do seem to be panning out the way we had anticipated, actually. Here's the first slide here, and I think it speaks for itself. The United States on the highest level of community transmission everywhere. This means there is community transmission all over the United States at a high level. All of the states now involved, high levels of community transmission, and it will be continuing to rise. In fact, today it reached over 1 million confirmed cases. Now there's a bit of a backlog because of the holidays, but it's still probably an underestimate. We did say about a week ago there was probably 1 million actual infections in the States, so it's probably only just catching up. Tomorrow it'll probably be a bit less, but the actual number of infections, of course, is always higher than the number of diagnosed cases. But really quite a dramatic slide there, really, from the United States. United Kingdom, well, pretty well the same, really. These grey areas here is where, unfortunately, Tim Spector's team can't get enough data, which is a pity. More people aren't filling out the COVID symptom tracker app. But we see that in most areas it's above 10,000 cases per million. So as we said, Omicron is basically running riot in the United Kingdom and the United States and quite a few other parts of the world, exactly as we said it would. And it's really hard to see how this is going to stop now. It's going to carry on. Now, in China, actually, they've locked down a couple of cities and they have actually stopped the progress of Omicron at the cost of locking down the entire population and taking food round in wheelbarrows and things like that. So it can be done in theory, and it can be done in China. I guess they're just preparing for the Olympics. In practice, in the rest of the world, it really cannot be stopped now. These graphics just speak for themselves. Now, how concerning is this? Well, this hospitalisation rate has fallen during 2021. Hospital admissions in England as a percentage of confirmed cases 10 days earlier. And of course, we know there's a 10-day lag in hospitalisation. So we see that as Omicron has replaced Delta, the admissions are going down, and this will carry on going down as Omicron is now the predominant variant. I believe that will still carry on going down. So let's look at some data from South Africa, which is the sentinel place we have been following, of course. So here we have the South Africa data. Now, this is really quite revealing and I do feel quite reassuring. So South Africa, the cases, so first wave, original type wave, second wave, beta wave, South Africa variant, third wave, Delta wave, fourth wave, of course, Omicron wave, went up very steeply, but it's also a lot thinner than the other ones, which is pretty good to see. And if we actually look at the cases now in South Africa, they are going down. Now, of course, cases are always a subset of infections, as we know. The testing isn't that brilliant, but this is the trend in South Africa. It is going down. So what has this cost South Africa? Well, here's really the screen that illustrates the most important thing about the cost, the deaths. So first wave, original wave, second wave, third wave, Delta wave, fourth wave, Omicron wave, and we see that the deaths are dramatically less. But of course, what this slide doesn't show is the huge increase in community immunity in South Africa that this wave has brought. And if we look at hospitalizations in South Africa, this is today's data. This is the 4th of January. They're down. They're going down. This is incomplete data, of course, but we see quite a nice drop in the last couple of weeks of 2021. And if we actually look at the live data for people in hospital, we see it's dropped below 9,000, 8,800, 690 in intensive care, 646 in high care, and in the whole country, just under 1,300 people requiring oxygen. And we do not see an increase. In fact, we see quite a good decrease in the number of patients requiring ventilation. And I am basically expecting a pretty similar trend in the United Kingdom and to a large extent in the United States. What should we do? Let's carry on, look at some more data. Let's look at the English-speaking countries, which we often do. Here we have those. So this is new daily COVID-19 cases per million. Now, there's some really interesting things on this graph. Ireland and the United Kingdom, which are both highly vaccinated, well, we see the Omicron variant is spreading dramatically in highly vaccinated populations. Now, this is not saying that people are vaccinated are just as likely to get Omicron as people that aren't vaccinated. They're about 40% less likely to actually catch it if they've had 3 doses of vaccine, but they're still catching it. They're still catching it. They're not getting as sick, but they're still catching it. That data there speaks for itself. Ireland and the United Kingdom, both very highly vaccinated countries. United States cases are going up. Australia, of course, they're going up dramatically. More on Australia later. Canada, we are seeing increases. New Zealand, still very, very low. But the point is, New Zealand can give their booster doses and do all that sort of thing and get ready for Omicron coming. But unless they're going to remain a hermit kingdom, not kingdom, whatever it is, a hermit republic, or can't remember what it is now. Anyway, a hermit country for the rest of time, they're going to have to open up, and there's going to have to be community spread of Omicron in New Zealand, unless they remain completely reclusive and closed, and that's just not practicable. Everyone in New Zealand is going to be exposed to Omicron. It's just a matter of when the New Zealand government decide it's appropriate to open the borders. And then they're going to go the same way as the decisions that Australia has taken. I don't really see any way around that, because Omicron is not going away from the rest of the world. Now, if we look at how this is transpiring into hospital patients, United States is increasing, but there's still some Delta going on in the United States, but some of that is Omicron now, we do know that. United Kingdom, this increase is now mostly Omicron. Considering the amount of cases we've got, of course, it's not that high, but it is going up. Canada, Ireland, Australia, in that order for increase in hospitalizations. Number of patients in intensive care, well, the United States is going up a bit. Ireland don't have up-to-date data. Canada up a bit. United Kingdom it's not. And Australia it is going up slightly, although as we'll see later on, there's still quite a lot of Delta causing most of the intensive care admissions in Australia. So Australia hasn't really fully transitioned from Delta to Omicron as the United Kingdom, for example, has done. Now, this is the R value. This is where we are today. This is where we are today as of Tuesday, the 4th of January. And this is R equals 1, that line there. So anything below that, cases are going down, as in New Zealand. Anything above this line, they're going up. And they're going up dramatically. So we see Ireland is increasing. Canada is increasing. The United States is increasing. And the United Kingdom and Australia actually increasing at the same amount at the moment. So dramatic increases there. And this line here responds to an R value of 1.8, which just shows you how quickly this is increasing. And this trend will continue for another week or 2 or 3, probably not 4. Very high R values. Now, SARS coronavirus 2 by variant. So the United Kingdom, yeah, that's about right now, about 96 Omicron. The United States probably still a bit behind. Australia, that is about right for Australia, actually, we believe at the moment. New Zealand, although there's essentially no cases, the ones that there are Omicron, but they've got them isolated at the moment, we understand. And finally, Canada. I would think Omicron is probably higher than that in Canada now, but don't have definitive data on that. So we are, our world in data is catching up with that now. Daily new confirmed deaths per million. Well, New Zealand, of course, low. Australia still low. Canada up a bit. United Kingdom, it has gone up. Is it starting to go down a bit there? Hopefully. Ireland, I think we've got a bit of a data drop out there in Ireland, really. United States deaths have remained high. I'm afraid we have to conclude that a lot of people in the United States have comorbidities. Particularly, I think obesity is probably playing a big factor in the ongoing problems in the United States. Now, thinking about schools now, schools are going back today, tomorrow, in the UK, and I guess in the United States as well. Now, this Omicron wave has hit us so fast that when schools broke up, there wasn't a fantastic amount of Omicron around, but now there is. So when schools go back, Omicron, although I know there's a lot of testing in schools, I know they're trying hard, but there's still problems with testing, and Omicron is going to run riot through English, British schools, US schools, and they're going to take it back to their parents as well. I have no doubt about that. So because Omicron didn't establish in schools pre-holiday, I'm afraid it will now, which is one reason why I believe the cases are going to go up for the next week or 2 or 3, probably not 4, potentially 4, but probably not, probably for the next 2 or 3 weeks. Cases are going to go up, carry on going up until this has basically got round all of us. Pathogenicity of Omicron. Now, I haven't put a reference on this, but I think it did come from this article here. This was actually Neil Ferguson speaking on a radio programme. Now, Neil Ferguson has got a few things, Professor Neil Ferguson has got a few things wrong in terms of his predictions, but looking at where we are now, he's a good analyst. So where we are now so far, pathogenicity of Omicron, how sick it's making people. If someone's had no infection, no vaccine, in other words, they're completely naive to the infection, about a 1/3 drop in hospital admissions. So we can say it's about a third less pathogenic to people that have not been exposed at all. 2/3 drop in the risk of dying from Omicron. So that's better, again, in people that haven't been exposed at all. So we can say about 33% less hospital admissions, about 66% lower chance of dying with Omicron compared to Delta. So definitive now, I think you can say definitive now, Omicron is less pathogenic. Now, before we go on to Australia, I just want to do a little bit more from the United Kingdom and the United States. So let's just look at some graphics. Again, these are bang up to date. These are from the 4th of January. Cases by date reported in the UK. So we see I think it was 218,000 today. So these are up. The reasons that these 2 days are low, of course, is largely delay in reporting due to the holiday period, but they are up now. So given that the number of diagnosed cases in the United Kingdom is about 218,000, what can we do? Can we double that for the real cases? Can we treble that for the actual number of infections? If it's 200,000 cases, I think we can say there's at least 400,000 infections. I think we're probably pretty safe in saying that. It is just spreading exponentially, as we saw with an R value of 1.8, so by definition exponentially, around the country, generating huge amounts of community immunity as it goes. So that's the daily reported cases. Patients in hospital, again in the UK, well, no question that it is going up. Hospitalizations are going up. They're nothing like they were at the peak of the alpha wave last winter, but they are going up somewhat. Now, several trusts have declared a critical state, and this is partly due to the increase in demand, of course, but it's primarily due to the fact that so many people are off sick and so many staff are having to isolate, that critical incidents have been declared in, I think, about 3 trusts around the United Kingdom at the moment, but largely because of staff sicknesses. And of course, Boris Johnson today thinks we're going to ride it out, and I think he's probably right. It is going to be a difficult few weeks in hospitals, that's for sure, no question about that. But we are generating huge amounts of herd immunity as we do it. Will hospitalizations carry on rising a bit more? Yes, they will. That is somewhat baked in, but will it remain at manageable levels, essentially manageable levels, with a little bit of help and a bit of jiggling around? I believe it will. I'm not trying to diminish this. It's going to be a stressful period for patients and staff. I've worked through lots of stressful periods before. It is stressful, but it should be for a short period of time, as we saw in South Africa. It was a pretty condensed hospitalisation busy period. But problems at the moment, yes. So that's patients in hospital. Now, this is patients on mechanical ventilation beds, essentially flat. So we are not seeing the sickest patients. We are not getting the admissions to intensive care. This has been the same now for, this is a month on this data, essentially the same. Went down slightly, going up slightly, but this is just sort of, I don't think we can read anything into that level of variation. So we are not seeing people getting sick like we did in previous waves as sick. It's very, very encouraging. Now, this is patients admitted to hospital in London, which of course was leading the way in the United Kingdom. So it's a good indicator. Now, I think some of this data is probably a little bit artificially low because of the holiday period, but the hospitalizations in London are actually down a bit. So have hospitalizations in London peaked already, indicating that they'll probably peak in the rest of the country in about 10 days' time, because the rest of the country is about 10 days to 2 weeks behind London. We don't know. Of course, we won't know for a few days until we've got a few more bars on that graph, but that is looking encouraging. Equivalent data from the United States. So as we see, this is from the CDC Live. This line here is 500,000, 500,000 cases. So it has been going up, but we know that the number of cases today is over 1 million. Over 1 million actual cases today diagnosed. That is despite significant difficulties with testing in the United States. So as we say, the real number of new infections in the United States today, I think we can say at least double that, at least 2 million. Although, as we said, that million is somewhat artificially high because of the holidays, but still a gross underestimate of the infections. So that's from the United States. Prevalence, these are patients actually in hospital at the moment in the United States. Now, no question this is going up. This trend is up the way, as we saw on the previous graphic. 74,000 is the current 7-day rolling average. The previous 7-day rolling average, 63,000. Nothing like as high as the peak, 124,000, but 17% up on the week and 40% down on what it was at the peak. So more hospitalizations to come in the States. Well, because of the increase in cases, inevitably there will be some increase in hospitalizations in the States. And just before we leave the data, let's just have a quick look at the rest of Europe here, or places in the rest of Europe. So I've left some countries on here for comparison. So Sweden increasing, Norway a little bit, Belgium a bit more, United States as we've seen, Italy going up, Portugal up, Spain up, France up, and the United Kingdom, this is just a delay in the data. This is not real. So we see quite a few European countries following on in the Omicron wave, a little bit behind the United States and the United Kingdom, but they'll catch up fast and their trajectory lines will be basically the same, because this really can't be stopped now. Without Chinese-style lockdowns, it can't. In fact, the Chinese can't stop it. All they've done is slow it down so they can get the Winter Olympics out of the way, I think. I think that's why they're being so draconian. After that, they're going to have to let it go through China as well. Now, a bit of data now from Australia. So New South Wales, Sydney area, cases up. That's actually out of date, but that was the increase in number in 24 hours. But the reason I wanted to show this data was the positivity in New South Wales. This is actually more than 24 hours ago now, but it was basically 27 and a bit percent. So of the 100 cases being tested, 27% coming back positive, indicating huge, absolutely huge community transmission. And that's despite, again, significant testing difficulties in Australia. Hospitalizations are up. Intensive care beds utilisation is up by 10, ventilated 27. But COVID positive patients admitted to intensive care since the 16th of December are 72% Delta, which means they're only 28%, I guess, Omicron. So, which is what we thought was roughly the ratios that we saw in England. So as Omicron takes over more from Delta in Australia, I wouldn't expect the intensive care admissions to go down, and hopefully these patients will work their way through and get out. and that will go down. But 72% of current intensive care patients Delta. And of those, 62% did not vaccinate or only vaccinated on one dose. Now, I've got an email from Darcy in Australia. It's like our government has thrown its arms in the air, just basically given up, thrown in the towel, I guess. But now it's ridiculous how far the polar opposite way we've gone. It's like night and day. So they've gone from the strictest place in the world to perhaps the most liberal, but one of the most liberal places in the world in terms of no restrictions. Clearly going for this community, herd immunity strategy. Now we have wildfire of COVID here in the Alpine Shire. That's an area in New South Wales. Very limited testing, great delays on PCR testing. I've heard delays of up to a week or more, so really no point in doing them if you're that delayed. Rapid antigen tests, these sort of lateral flow tests, can't get them. Sold out, very hard to get. Close contact is defined as someone who lives in the same house and has been there for more than 4 hours. So clearly Omicron is massively more transmissible than that. Darcy could go on for quite some time. In the coming weeks, I would think we'll see an explosion in cases here in Victoria and especially Melbourne. So, yeah, I would agree completely. New South Wales, Victoria. What's the other one? New South Wales, Victoria. Anyway, I've forgotten. Apologies to everyone in Australia. Anyway, we're going to see a great increase in these cases in Australia. No problem. The only one the only part of Australia really where they're still low is Western Australia because the borders are still closed. But again, Western Australia has got the same problem as New Zealand. Sooner or later, everyone there's going to be exposed to Omicron. It's just a case of when the government decides it's the right time, and hopefully they can do it slowly rather than doing it quickly. Now, just briefly before we finish, a bit on vaccinations. South Africa, Johnson & Johnson seems to work. Now, this study's vaccine effectiveness against hospital admission in South Africa. Healthcare workers who received a homologous booster of Johnson & Johnson during the Omicron wave. In other words, they'd had a Johnson & Johnson homo the same. They had another one the same. So they had 2 Johnson & Johnsons. And they studied this on over 477,000 healthcare workers. And 6 to 9 months after the first dose, and they actually evaluated nearly 70,000 of them. And they compared it to unvaccinated individuals, and with a booster dose, 1 to 13 days after the booster, there was a 63% reduced chance of being hospitalised, going up to 84% after 2 weeks to 4 weeks, 1 to 2 months, 85%. And this is what we're seeing with these adenovirus vector vaccines. They work well, but often work more slowly, and may work for longer than sometimes the mRNA vaccines work. And of course, the Oxford AstraZeneca vaccine is another adenovirus vector vaccine, and it's a year since that came out, believe it or not. I can remember sitting here quite vividly talking about it, but that is a year ago. So Sir Andrew Pollard, Joint Board of Vaccination and Immunity, talking about Germany and Israel. 4th jab should not be offered until there's more evidence, which of course we completely agree with. This is one of our trusty. We haven't had our trusty sayings for a while, have we? But that's one of our trusty sayings. Follow the evidence wherever it leads. Seems a while since we've done trusted sayings. Anyway, Germany starting to do a 4th dose. Israel starting to do a 4th dose. Israel a bit different really, because Israel started vaccinating very early. So there's been more time for immunity to wane in Israel. So slightly more understandable there. But Sir Andrew says giving boosters to people every 6 months is not sustainable, which of course it isn't. He's completely right. It's not sustainable. I'm hoping that my booster dose is going to be the Omicron virus, because I am going to be exposed to Omicron, and I'm expecting that to give me a good level of immunity. And we know that if you've been exposed to Omicron, that gives you good levels of protection against Delta, and hopefully against the next variant that comes along. And because Omicron is so transmissible, I'm expecting that to be the prevalent most prevalent variant for the foreseeable future, I would think. At some point society has to open up, of course it does, and Omicron could well be the opportunity that we have been afforded to do that. When we open up, there will be a period with a bump of infections, so they'll go up, which is why winter is probably not the best time. Well, I agree with Sir Andrew Pollard here. Winter's not the best time, but unless we have a Chinese-style lockdown, we cannot stop Omicron because it is so transmissible. Unless we're prepared to lock down cities, stop everyone going to work, take food round in wheelbarrows, Omicron, I believe, is going to spread. So really, Sir Andrew here is implying that it's the politicians that have decided it's going to happen in winter, but actually I think it's more the biology of the virus, to be fair. And I think if we talked to him about that, he would probably agree as well. But that's a decision for policymakers, not the scientists. Well, we'll leave that as a question mark. Our approach has to switch to rely on the vaccines and the boosters, says Sir Andrew Pollard, is his view. The greatest risk is still the unvaccinated. In terms of severe illness, of course, he is completely correct. The worst is absolutely behind us. We are in the end game of this pandemic. We just need to get through this winter. And then by spring, I think everything's going to be fine. Now, he did talk a bit about misinformation as well in this article. Some European leaders, I wonder if he's thinking about France and Germany, who questioned the efficacy of a vaccine in over 65 and did seem to focus quite a lot on the side effects of the vaccine. Because what seemed to happen was when some clever, oh so sophisticated, oh so scientific European countries, of course not acting through nationalistic spite or anything like that, or egotism. But when these sophisticated scientific countries started to pour doubt on the Oxford AstraZeneca vaccine, for example, some African countries sort of didn't carry on with their programmes as they would have done. And Sir Andrew seems displeased at this, as indeed am I. Highly likely to have cost lives in Africa. Misinformation risks people's lives. It's highly likely that people became seriously ill and died because of vaccine misinformation. I mean, I do hope this is not vaccine misinformation from politicians like Emmanuel Macron, who said the Oxford vaccine is quasi-ineffective. Let's just say that comments made in mainland Europe affected people in Africa. I mean, I share his rage, which he is so conservatively expressed. Okay, just thinking actually, that poster, Stop COVID-19, might have to do something about that because I don't think we can stop it now. Anyway, thank you for watching today's video. What we do need to do though, if we can, I'm not saying go away and relax everyone, we need that one. Another reliable saying, we need to flatten the curve, make this go out for longer, more slowly if we can, to limit the pressure on hospitals. So I'm still wearing my mask in public, of course. Thank you very much for watching.